Let's debrief a little bit on some of the things that we've learned today. Let's bring in our final panel, Dr. Lee Gable, Justine Blanchette, Dr. Jamie Benham, Dr. Lauren Walker, and Dr. Jennifer Gordon. Come on up, pull up a chair. So we've met most of these ladies today, except Dr. Jamie Benham, who is an endocrinologist and leads the Embrace Women's Health Research Lab at the U of C. And Dr. Lauren Walker, registered psychologist and adjunct associate professor in the departments of oncology and psychology at the U of C. And should anybody here, we didn't really talk cancer today, but should anybody here be in the cancer battle or know anybody in the cancer world, our psychosocial oncology program at our cancer center is world-class, world-renowned, incredibly helpful, and many people don't even know it's there. So just a little shout out to my friends in psychosocial oncology, who I absolutely love and was integral in my battle. Okay, we've had a long day. We've had a lot of information, but this is your final chance for those final questions to help lead you down any roads that you want to go down. So anybody have something off the top of, there we go, right here. Oh, right there. And we'll go there and then we'll come to you. Shelley.
Hi. One thing that wasn't talked about today at all, we talked about progesterone, estrogen, and I know in the movie it said that testosterone wasn't approved yet, but it is now in the States. Where's Canada at?
Who wants to take on, okay?
I would love to take that question. Thank you so much. So testosterone is something that we're starting to see more and we're getting a lot of questions about in clinic. And testosterone is an off-label medication that can be used for women for the treatment of low libido, ruling out other causes of it. So it's something to talk to our doctors about, but it's not a part of our routine menopausal hormone therapy.
So as of yet, so keeping our eyes on. Shelley, I think you're next. Right there. Yep.
Hi. Just a question. In the video, it did allude to, like, I happen to be one of the 20% who didn't have the hot flashes. But that's also a bit problematic because they say, do you have symptoms? And you go, no, well, we aren't going to give you any hormone. It's therapy, right? And so I am 62, but I'm less than 10 years postmenopausal. And so that's sort of like, is this a good idea or not? My gynecologist is like, yeah, absolutely. Had a long talk. Here's a prescription. Because I also have osteopenia, and I did start strength training, and I'm an instructor now, and it's been great. But they alluded to osteoporosis prevention. My mom has osteoporosis, and so we haven't really talked about the 20% that don't have symptoms that are like, is this going to benefit my bones? And perimenopause is a little away from me, but I also got diagnosed with ADHD 5 years ago, so is part of it, ADHD is part of it.
Well, we've decided we all have ADHD now after that fantastic ADHD
it was great. It was
presentation.
Great.
Like, did we all see ourselves in there? Whatever. So kind of a combination. ADHD should be the first, I think what we learned today is ADHD should be the first one you take on because it can have so many other things associated with it. Does anybody want to take on osteoporosis, ADHD?
I would love to talk on the osteoporosis piece. So Dr. Laura Hins gave a great talk this morning with lots of good recommendations. And in our Canadian osteoporosis guidelines, we don't recommend menopausal hormone therapy for osteoporosis prevention, but the strength training and all of the lifestyle pieces certainly are.
Oh, yeah, remember? Now I remember. Cheese and jumping.
Sorry, yes.
Wasn't that what it was? And good for you for taking on that strength training. You're an instructor now?
I am, and I'm doing my personal training course as well. But as soon as I got that osteopenia, I thought I got to, ramp it up. So it's really been helpful. I'm
walking away from today thinking I have to ramp it up.
Yeah.
100%. Things need to be ramped up a little bit. Anybody up here? Anybody have any questions for Dr. Lauren Walker, the psychologist? Oh, here's one over here. Can you grab her? And have we got one over here? And we'll get you queued up. There, we'll get you queued up for next.
It's not necessarily specific to Lauren Walker, but kind of like a global question is there's a lot of misinformation. We talked about it a lot today around like periods, menopause, all of this situation. And my real question is how really, especially like I'm a young person and we're obsessed with our technology. You hear like screenagers all the time. How do we like weed through all of this misinformation to really find what can help us specifically? How can we deal with this?
Well, you start with your critical thinking skills. You start there, and if someone's telling you lemon water every day is going to cure all your ills, you're like, maybe, maybe not.
So I can speak to a few things that I like to keep in mind as red flags. One is if it sounds too good to be true, it probably is. So if it's sort of a miracle cure that will fix all of your ailments, that's probably not scientifically backed. Some other things we can think about are the sources where the information is coming from. So do these people have adequate credentials to support the claims that they're making? And what kind of scope are they practicing in? So if someone has doctor in front of their name, what are their actual credentials? Are they a physician and they're speaking to things that are within their practice? Is it someone who's talking about cardiology, even though they have no training in cardiology? So I think that's an important one. And the third one I like to think about is what are the things that might bias that person? Do they have another benefit that they may be gaining by sharing that information with you? So are they selling something? Do they stand to benefit financially? Not sure.
Are you new to social media, Lauren? That's what it's all about.
Yeah, so we have
I
to
could
be...
call myself whatever I like and go out of my whole
careful.
scope. So you do have to be really, really careful.
I think also, I mean, there's more and more, I guess, pressure on researchers to create resources for the general public, which is great. So there are a lot of like research labs that have, Twitter, or I guess not Twitter, that's old, but, Instagram. So if they're, for example, I don't know, my lab comes out with stuff on PMDD, and then you can be relatively confident that, it's decent information. Or there are these organizations like iapmd.org, for example, that has a clinical advisory panel and everything is vetted. So I guess seeking out if there are particular topics that you're interested in, like following those research labs and organizations that really produce reliable information.
And check out Science Up first. They're an excellent source that actually gives you really good guidelines of how to decipher if this is good information or not.
Even the fact, though, that you're asking about that tells us that you're maybe a step ahead of some folks who would just willingly and blindly go down the road of that. So the fact that you're even thinking about that probably puts you a little bit further ahead. But that's good. That's good advice. If you have a topic that you are sort of interested in, find the credible source before you start getting overdone with non-credible sources. Right? So that's excellent advice. I think we had one over here, and then let's get keyed up over there. Thanks.
Hi, so I'm a personal trainer and nutrition coach, and I work with a lot of women in this perimenopause stage. And a common frustration I hear is that they have not changed anything they've done with their diet or exercise, and suddenly they have this weight gain. And a lot of women are looking for this magic solution that will make it as easy as it used to be. So I'm curious about what we know from research, because I found it interesting in Dr. Premji's presentation. She mentioned that hormone therapy has not been shown to help with that weight gain piece. And so do we know much about how much of it is that our metabolism is also changing at this age, or that we tend to be more sedentary at this age, or that maybe the mental health components are making it harder to get motivated to be more active? Do we know much about this?
Boy, I think we add 5 more to the list that you just gave,
Yeah.
and all of that, right? But from the expert point of view.
Yeah, I can speak a bit to this. So they've done trials around weight loss on women taking HRT and seen no changes in weight. So that's what Dr. Premji was talking about. I think it's really complicated. It's hard when it's nuanced. First of all, if you are not sleeping well, you do not have the energy to get up to do that workout, your food choices tend to change as well. So if sleep is an issue, you gotta work on that absolutely first, because everything else goes out the door. We know that women will experience body composition changes and weight changes. Some of that might be hormonal. A lot of that also might be these other issues that impact everything else we're doing. It could be the life stage where you don't have enough time. You've got other things going on with kids or work or whatnot, and they all add up. The other thing that I think is quite common, and you might see this as well, is that often women may not actually be exercising or working to the intensity or effort that is needed. So maybe it was okay through their 20s or 30s, they were able to get by. But then when you start asking, okay, is that actually an intensity that you're fatiguing or is actually hard? A lot of women don't know what that actually feels like because they haven't ever taken themselves to that point of experiencing what that feels like. So I don't have a clean answer, and I think it's a lot of things, and it's probably different for every woman.
But I think you had some really good points. Really, you know what? We don't want to hear that from you. Sorry, but we don't want to hear that from you. But if you could couch it in these terms of where we're starting here, and this is impacting, and this is impacting, and this is impacting, and actually you're maybe not working as hard as you think you are, but you would say it nicer than me, as hard as you think you are at the intensity, then I think if I was a client of yours, I would sit and I would listen to that. Because I've had a whole day of listening now. I think I would sit and listen to that and say, okay, well, it's unfair and I want to whine, but I do see the science in it. So,
Leslie, can we touch on one more thing?
Yeah.
Often when these things start to happen to women, start food restricting or calorie restricting, you cannot gain muscle if you are restricting your diet. Like, it's not possible. You can lose fat in a calorie deficit. That's what's needed. You will not build muscle or strength at all. So I think the nutrition piece is really key too. And sometimes that also goes out the window.
Oh, I feel bogged down by all the things in my life I have to fix. But at the end of it too, at the end of it, like, because when you make the effort, you see the progress, you see the work, right? That's a good reminder that if you're in restricting, that you're not building muscle, because you made it super clear to us that we need to build that muscle and take those steps. So I am not restricting anymore. I'm done with that shit.
And throw out your scale, Leslie, because if you're building muscle, you're gaining weight.
That thing out.
Right? You're going to gain weight if you're building muscle.
I'm
That's
done.
a great thing.
The scale doesn't control me. Go ahead.
I'd like to ask about breast cancer survivor, especially for those with ER positive and PR positive with high score. So we are told that HRT is not safe, but now it sounds like it can protect heart disease, preventive. So all that, but then there are a lot of nuances. Then how are you going to weigh the benefits and the risk? This is so complicated.
Which is why you and I aren't doing it, right? This is why we go to the experts to do that. Does anybody want to? It sounds like a Dr. Premji. Good, you're good. Good, thank you.
So when we're thinking about menopausal hormone therapy, we're thinking about the risks and the benefits. And so for every person who's coming into clinic and having a discussion about it, the answer is going to be different in terms of what the right answer is. So for individuals who have a history of breast cancer, menopausal hormone therapy that's systemic and working throughout the body is not recommended, but there are other options to chat with your provider about. So seeing them about what other options are available to help to manage the symptoms is important. And then I'll let Dr. Walker talk about vaginostomy.
So there's different ways that MHT can be helpful. We think about systemic use and that you're taking something that is impacting your whole body versus vaginal hormones. And it used to be even a year ago, 2 years ago, there was a lot of reluctance about whether or not breast cancer survivors who are ER/PR positive should be taking vaginal hormones. And we're seeing increasingly now that is very, very low risk. So it is a conversation still to have with your healthcare provider, but we are much less concerned about vaginal hormones than we used to be. So that one, I would say, make sure you're having a discussion about that if you're having any kind of genitourinary symptoms.
Yeah, that sounds good, right? No, that sounds good. Is that things that we may have thought were correct, like stay away, may not necessarily be correct anymore. So having those conversations, but arm yourself with a little information first before you go in and have those conversations. I've really learned that today, that make sure you've got some information before you have the conversation. Something over here?
What is the status of rights in the workplace? So those going through menopause, looking for workplace accommodations or time off. Just wondering the status of that and moving forward.
Hey, good one.
Good question. So, any of you who'd seen the sister film to this one, The M Factor, they actually talked about some US-based companies who have essentially a menopause leave for their employees, and that's really groundbreaking. It's not something I've heard of in Canada. It would depend, sorry, that's my answer for everything, on the individual's situation, the individual's workplace situation, whether they're a unionized employee, non-unionized management, etc., the level, if you own your own business, right? It would be really factor specific. I think from an employer's standpoint, things they would want to think about are the cost to the business, whether it would be partnered with an insurer like a typical short-term disability or long-term disability plan would be. And the challenge, I think, probably from an employer perspective is how long and are those benefits offered, and what are the triggering symptoms or indicia that would give rise to a benefit. So when we think about a workplace benefit, something like a traditional medical leave where you're having a physical or a mental issue, you go to your healthcare provider, you receive some kind of note that you can take to your employer, who then often will provide that to an insurance provider or you do directly, and then there's a defined benefit that is in place and it's defined by terms of a contract, and it's usually a fixed finite period and for a certain amount of money. Similarly, for a maternity benefit or a parental leave, right, it's similar. There's one indication that gives rise, it's a health care indication that gives rise for a finite time, and it's defined. I think the challenge that employers will face and legislatures will face is that, as we've seen today, it's such an individual experience with such a wide-ranging time frame in women's lives that, as a society, employers, governments, legislatures are going to have to grapple with how do we support people in the workplace. But I think the fact that you're asking the question is excellent, and it is something that I know that a lot of employers are thinking about in terms of how do we keep women in the workplace, how do we keep women in management, how do we keep women at the decision-making table and help support them through challenging times in their lives.
Yeah, that was an excellent question. Thanks for that. We have time for one more. Wait, do you want to come down here? Oh, there. Go. Yes, please.
Hello. Thank you for your all being here. I'm 61, and I'm super discouraged because I feel like I was this strong person that was controlling the hot flashes by not taking any HRT. Look at, I'm doing it with my diet. I'm, figuring things out on my own. Aren't I amazing? And now I feel like I should have got the HRT and that I've really missed out on this window. And I'm wondering, is it 60 that we can't do anything now, that I'm left to wither out and crumble and go senile because I'm over 60? Is it because we don't have the testing, or what would stop you from helping us now? I feel really discouraged by some of the information I'm getting.
No, that's a good question, and I think it's something that's coming up a lot recently because we did have that WHI study that we've talked about today, and there was a large period of time where a number of people did not receive menopausal hormone therapy. The current guidelines recommend within 10 years of your last menstrual period, or less than 60 years of age in terms of starting menopausal hormone therapy. And the reason for that age is because we do know that the risks go up significantly if we go out of that window in terms of the risks of heart disease and stroke. And so it's really important to take the risks and benefits when we're talking about the different options that we have in terms of management. But there are other management options for hot flashes and night sweats that continue. So certainly checking in with your healthcare provider and looking at your individual symptoms that you're experiencing and what management options might work best.
And really, don't be discouraged. I mean, give yourself a bit of a pat on the back as you went into this thing and you were like, I am going to manage. Like, managing is better than laying on the floor, right? So don't feel discouraged, feel good about your approach and see if there are options for you going forward. Don't look back. What went on, went on. Look forward and say, what can I do from this point on?
Thank you for saying that. Part of it is that I want those benefits that aren't just the hot flashes, because I seem to be able to deal with those. I want that bone and that Alzheimer's and those ones that seem to be a bigger lifestyle issue.
Well, for sure, start with cheese and jumping.
Yeah.
We've all learned that, haven't we? So fantastic.
Yeah, and you haven't missed the boat. You for sure have not missed the boat when it comes to bone. And HRT has never been a first-line treatment for those with low bone mass or osteoporosis. There are other medications that would be prescribed by an endocrinologist if you're at risk, at a high risk of fracture. But you can start exercising, strength training anytime, and it will still improve. So do not think that you have by any means missed the boat.
There's your kernel of encouragement going forward today. You heard it from the pros. We've heard everything from the pros today. It's been a fantastic day. I've learned a ton. I'm sure you've learned a ton. Going to go forward and take this information. We're going to stay put here. Dr. Brennan's going to come and wrap us up for the day.
What we've learned today has not only expanded our knowledge, but has sparked vital conversations that are going to resonate into tomorrow. Tomorrow, March 8th, is International Women's Day, a global celebration of women's achievements and a reminder of the work still ahead. In Alberta, we have witnessed significant strides towards improving women's health. Suncor's recent $5 million investment through the Calgary Health Foundation into the Suncor Women's Health Centre, which was announced last month and is the first major gift to women's health in Calgary, exemplifies this commitment. However, the journey towards comprehensive women's health is still ongoing. It requires our collective effort, healthcare providers, researchers, policymakers, and community members, to continue advocating, educating, and innovating. By fostering partnerships and supporting women's health initiatives, we can create a future where women's health is prioritized and disparities are eradicated. As we conclude, I encourage each of you to carry forward the knowledge and connections gained today. Share these insights with your communities, support ongoing research and initiatives, and continue to engage in dialogues that challenge the status quo. Today's presentations will be uploaded on both the O'Brien Institute for Public Health's website as well as the Calgary Health Foundation, and when they're live, please forward them to other women in your lives who may benefit. Finally, before we all part ways, I wanted to offer one last thanks to our dedicated partners in organizing this event: Calgary Health Foundation, the University of Calgary's O'Brien Institute for Public Health, and the Sex, Gender, and Women's Health Research Hub, as well as the Calgary Public Library. Thank you to everyone who agreed to be a speaker today, to the volunteers, and to every attendee for contributing to the success of this symposium. Together, we're not just participants, we are active contributors to a movement striving for a healthier, more equitable future for women. Safe travels home.